Hey, Guru Nation. So I promised you a quick update to my journey here in Yuma, Arizona. So I got actually, since my last video, I have two studies and I have a family practice doctor. They required two specialists. They required a dermatologist and an ophthalmologist. So I was able to get two dermatologists interested. Not only that, both dermatologists are interested in doing studies in their own offices in addition to my current PI. So I'm like turning into a mini SMO, although we don't call it that anymore. We just call it a site network. But it doesn't matter in a place like in an underserved place. It really doesn't matter as long as you have the quality taken care of. We're going all electronic, everything Creo, eSource, eReg. We're going to have a patient texting platform, auto reminders. So today I met with an ophthalmologist because remember, I also needed an ophthalmologist. He insisted on giving me this exam just to show me what it would feel like to be a patient in the study, because we need this for one of the assessments. Really cool guy, willing to be the sub-I for my study. So now I could finally say yes to the sponsor. We could do the study. So it's looking like I'm going to get my first study. And on top of that, he's also very interested in doing studies, ophthalmology studies in his office as well. So I went from one PI to now one, two, three, four potential PIs, although two of them are derms. So I don't know how that's going to work, but three different specialists um, under my site. And just wanted to give you an update. Look, the following up definitely matters. This didn't just happen where I popped in and I brought like donuts and they just roll out the red carpet. It didn't work like that. I had to go one day, then the next day. So the first day, the gatekeeper told me, well, okay, nobody's here right now. So the next day I went, the business person was there. She said, okay, leave information. Then she needed more detailed information. So I had to come back. I brought my book. It was a smart thing to bring the book. The very next morning, the doctor called and said, can you come today and talk? That's what happened. Same thing with the dermatologist. Those guys are hard to track down. Specialists in these small towns are very busy, very hard to get a hold of, much busier than Orange County and LA County that I'm used to. But I brought the book. Both were interested, but both of those required following up too. Like, matter of fact, one of those derms I didn't even meet. I just met with their business development person and they passed the message on to him, and then he sent me his cell phone and so we can get in touch too. So it's just constant following up. I was getting a little discouraged because I was like, man, I don't think we're going to be able to do this study because I can't find the specialist for it, the specialist sub-Is, but we were able to. And stay tuned because it looks like exciting things coming up. Of course, thank you so much for following the journey. Talk to you soon. Bye bye.